If you're presently in the horticulture business, it is possible that Jimmy Montu was once your trainer. But for the last 5 years, the serious onset of lymphatic filariasis, better known in our region as elephantiasis, has prevented him from living life he would normally enjoy. He lived with a swollen leg for a whole year before he was finally diagnosed with lymphatic filariasis.
When the doctor first told me about it, I felt really bad. I was sort of sick for that day. Came home and thinking about it, that this is a lifetime disease. Like other diseases, you die quickly. This, the longer you live, it's torturing. You feel like committing suicide. You know that it's, after learning that it's a permanent disease, it's a life-torturing disease, and there's no cure.
Lymphatic filariasis is a disease caused by parasitic infection with a nematode worm that lives in the human body. Adult worms produce millions of microfilari which, after 4 to 6 years, begin to prevent the normal flow of lymph that then leads to swelling in various parts of the body. Montu insists people take preventative tablets. He never took them when he was traveling around the region as an instructor for a number of years. Wanganga, big leg, auraki mentamata, rectella recus, mumu tutupa, muirara, filariasis pur, mocopata, fa'efua, legibiki are the different names lymphatic filariasis is known as in the Pacific for the last 2 centuries. The first notes on elephantiasis were off Tonga by Captain James Cook in 1785. Of the estimated 8.6 million people in the Pacific region, 7.9 million are at risk. In 1999, the Pacific Program to Eliminate Lymphatic Filariasis, known as PACHealth, was established to seriously address this public health issue.
PACHealth is the Pacific Program to Eliminate Lymphatic Filariasis. It's working 22 island countries in the Pacific. There are 22 island countries and territories in the Pacific. All those 22 island countries, territories, working together to get rid of this disease from the Pacific by 2010.
PACHealth is supported and works in partnership with the World Health Organization and other institutions such as the Center for Disease Control and Prevention at Emory University in Atlanta and the Liverpool Lymphatic Filariasis Center in England. PACHealth has put the region on the map as a world leader in terms of working towards the elimination of lymphatic filariasis.
In the Pacific, now in 1970, 20%, but in 1990s already dropped to as low as 6%. Now, today, we are almost approaching 1%. So this is a fantastic achievement.
More than 1 billion people in 80 countries live at risk of contracting the disease. Today, 120 million have already been infected, while 40 million have been disfigured or incapacitated. The fight is led worldwide by the Global Alliance to Eliminate Lymphatic Filariasis, GELF. Established in 2000, GELF is a public-private partnership to assist in advocacy, resource mobilization, and program implementation in this war against filariasis. When opening the 4th global meeting in Fiji, hosted by the Pacific region in March 2006, Fiji's Vice President Ratchoni Mandraiwiwi labeled lymphatic filariasis a scourge.
Lymphatic filariasis is a scourge not only because it is physically repugnant to the eye, with its distensions of body parts, but it is a blight on the lives of those infected, making them wretched, miserable, despondent, and even suicidal. If that were not enough, it can be a painful and debilitating condition as well.
Mass drug administration, or MDA, is the main preventative method. It presently reaches 600 million people. Of the 22 Pacific countries, 6 do not have filariasis, 5 countries have it but only in certain areas, and the remaining 11 is where intensive mass drug administration is ongoing, beginning with Samoa in 1999.
We had been complacent. We had sort of sat back and accepted, elephantiasis as part and parcel of adulthood. And so it was becoming quite frightening for, public health specialists as well as World Health people, experts that were coming in the country for that.
Essential drugs are provided for free by GlaxoSmithKline and Merck, 2 major international pharmaceutical companies. GSK is one of Canada's leading research-based pharmaceutical companies. Merck is a research-driven pharmaceutical company headquartered in the US that discovers, manufactures and distributes unmet medicine needs.
If there is no government commitment, then there really cannot be a programme. It has to be within the government's priorities, and we really do have to look to governments, encouraged by the scientific and the non-governmental community, to have this as a priority, because it's one of the few conditions where you can stop it forever.
Through the Global Alliance and WHO.
Samoa, Niue and the Cook Islands are leaders in terms of work towards the elimination of lymphatic filariasis. If this figure is applied to infected populations, at least 425,000 filariasis infections would have been treated by the end of PACHELP's program. That is why achieving elimination for the region by 2010 is realistic. GlaxoSmithKline and Merck have pledged to continue their support until 2020, when the Global Alliance hopes to eradicate filariasis in the world. All drugs are endorsed by the World Health Organization.
We have provided one of the 2 medicines that the WHO have recommended. The meeting that Dr. Dadze referred to, where the commitment was made to eliminate this drug, came up with a recommended strategy of the 2 drugs. And so it's really the WHO, as he said, taking the lead in this. We have one of the 2 drugs that are available, and we decided, because this was something that could be done within a limited time period, albeit a long one, 20 years or so, that we would commit to donate as much medicine as was required for this clear program. And we're very happy to do it. And this year we will have donated about 500 million tablets, and we've said we will commit to do this. We're here to the end.
We have a commitment to keep donating Mectizan for as long as necessary, and Mectizan, its safety and effectiveness have been proved through clinical trials, and Mectizan has regulatory approval by the French regulatory agency for use in lymphatic filariasis, and so we're absolutely confident in its safety and appropriateness to be used for LF in conjunction with albendazole.
The medicine provided by 2 manufacturers, WHO officially put on record that drugs are safe and effective.
The search for ways of sustaining successes achieved is being sought. The need for more funding is another area which governments are encouraged to support.
The one critical obstacle facing most countries engaged in filariasis elimination is the lack of adequate funding. We need to raise the funds for countries to continue with their programs of mass drug administration, and for others to scale up their programs to cover their total at-risk population.
The problem that disease-specific activities like filariasis, like river blindness, like trachoma have, are related to the fact that they're small diseases in the bigger context. And so what we have to fight is the issue of these are diseases of poor people. They're very, very cheap to control. They really do have an impact on the life and the well-being of poor communities and poor individuals. And we can make a difference in some parts of the world for less than a few cents per year. And that is as they say, a rounding error in a budget, and we need to get these diseases prioritised because we actually can make an impact on the lives of poor people.
We need money like everybody else to be able to mobilize communities, to be able to be assured of resources and things like that. And having to convince our own governments to have, a budget allocation for filariasis.
If you are talking about a global attempt to eliminate something like this, it must come from the top. But don't forget, it works when it gets to the bottom. It must get to the grassroots level.
It is our generation that has the chance to finally eliminate lymphatic filariasis, and I suggest that we take this challenge very seriously.
The public's attitude towards elephantiasis drives people into isolation. Education is the key. Those affected need to understand and accept their condition and the difficulties it brings. But society, Montu says, must also be educated on the disease itself. He says with more education, people could understand their condition and difficulties and accept them as they are.
Usually I'm in town twice a week, now once in 3 months to have a haircut. And I feel bad going to people's places. I need to buy 7 meters of white calico just to tear them up into bandages. Money is going on to the chemists for Savlon, cotton wool, and visiting the doctors, and antibiotics and painkillers, just to make you feel comfortable. When you're in public, you could notice that there's, that eye from the public, and then you couldn't go to places because it smells sometimes. You need to wash it twice a day. And public transport, I can't go on public transport. I'm scared to go into supermarkets.
Keeping the infected areas clean is important, and washing infected areas twice a day is a strategy towards the prevention of disability. Another involves surgical procedures. Research conducted in London on tropical diseases may, however, soon offer a cure.
The research that is going on actually in the Liverpool School of Tropical Medicine relates to the impact of doxycycline, which is an antibiotic, on organisms that live inside the worms which cause filariasis. If you kill the bacteria in the worms, then the worms don't survive. Studies that have been done in Tanzania on doxycycline have actually shown you can kill adult worms.
Lymphatic filariasis can be prevented. Its elimination can be achieved, but people themselves must be willing to participate in these efforts towards complete elimination by 2020. Multifaceted strategies are being developed to secure support, whether financial or otherwise.
I think it's time ministries of health accept that they can never, with all the resources they have, they can never do health on their own. They need other people. They need people like you in the media. They need people outside of the ministries. They need non-government organizations. They need community and church groups. So the multifaceted approach, of course, it's been very sexy, like some people say. When you want to be impressive, you talk about multifaceted type of approach. But you need to apply it practically and be genuine about it.
For Jimmy, life goes on. He waits in hope for a cure, praying his leg does not get any worse.
To the public, or the whole Pacific, or whoever's listening, please, I wouldn't like anyone to have this disease. Take the pills, because it's available in every health center, every hospital. It's free, you don't have to pay for them. And make sure that your whole family takes the pills, except for pregnant women and children who are under the age of 2.